My name is Michael Hardy, and I'm an emergency room pediatrician. In this video, we will discuss the process of performing a simulation learning event, including the necessary elements that need to occur before, during, and after the simulation session. The first thing to do is to pick a case that you wish to simulate. You may need to adapt the cases for your local emergency department. Review the case and make sure that you can obtain all the necessary materials, including a task trainer, procedural tools such as IVs, and a monitor for vital signs. Ensure that the equipment works. Try to recreate the location, look, and feel of the participant's work environment. For example, place the mannequin in a gown in order to maximize realism. Prior to simulation, you should consider whether or not you need additional equipment for moulage, which is the art of applying injuries via paint or other supplies. You will also need to make sure that you have enough personnel to perform the simulation. For example, you will likely need another person to facilitate by running the simulator, providing physical exam findings, and/or by role-playing family members. It is also important to review additional documents such as evaluation and debriefing tools. On the day of simulation, start by establishing a safe space for your learners. For example, you can say, "We recognize that you are smart, competent physicians who want the best for your patients. The goal for this session is to improve your skills and comfort taking care of very ill patients. This is a space for you to try new things and push yourself. No one is here to judge you as a provider or as a person. Please treat others with respect and maintain confidentiality. That is to say, whatever happens in this room stays in this room." Orient your participants to the task trainer. This is the task trainer. Treat the task trainer like a real patient, verbalize your actions, and the facilitator will provide you with exam findings. On this task trainer, you can intubate, place an IV, and an interosseous line. Orient your participants to the location and availability of supplies. Also orient them to the monitor with the vital signs. Identify yourself as the facilitator to whom requests and questions should be directed during the simulation. Then, share a one-sentence description of the patient they will be simulating the care of. For example, you are working in the ED when the triage nurse tells you that she just put Priya, an ill-appearing 12-month-old girl, in the resuscitation room. She has had 2 days of fever and is listless. Her weight is 10 kilograms. For less experienced teams, simulation roles should be assigned by the facilitator, while more experienced teams can assign roles to themselves. The simulation scenario then proceeds as written in the case description, responding to actions performed by the learners. If the trainees get stuck and miss a physical exam finding or a critical piece of history, or don't know how to implement a critical action, the facilitator may choose to ask a question or to have an assistant provide a hint. The facilitator needs to balance keeping the team from failing to meet the learning objectives with the team's opportunity to work through a problem. After the scenario concludes, it is essential to discuss the events of the simulation with the team by debriefing. Debriefing will be covered in depth in its own video. Learners should then fill out anonymous evaluation forms about the effectiveness of the simulation scenario and asking for ways to improve future sessions. After the evaluations have been completed, they should be reviewed carefully, looking for trends across learners. Consider how to incorporate learner feedback into future sessions.